sudan. Sana all.
Good day to everyone. My name is Ms Jackielou Borja from NCMA Batsi Trainees, Nurse Caregiver Management Alliance. Now, I would like to show you how to occupy bed making. First need to do is introduce yourself. Hi sir, I'm Jackie. I'm here to change your bed. May I know your name, sir? Oscar. Okay. What is your birthday? Okay. Thank you. Have three identifier. Introduce yourself, verify and explain what you are doing, and then the patient is aware. Now, assuming that I wear a PPE already and wash my hand and wear gloves. So now, let's do the complete privacy as well. Okay? And then, I'm start now to change her bed. Ang una ko pong gagawin ay tanggalin ko po itong blanket niya. So now, kukuha po ako ng malinis na blanket. Ito po. Bago po tanggalin ang blanket niya, ay kailangan po natin untuck yung nakatakin. Kasi po yung mga gilid ay nakatakin po sila. Lalo na po dito sa part ng may talampakan. Nakatakin po yung blanket niya. So now, bago po tanggalin yung nasa ilalim is mag-ask po tayo ng favor dun sa patient if kaya niya pong hawakan yung ends ng linen. If hindi niya po kayang hawakan yung ends ng linen, isiksik po natin itong malinis na blanket dito sa may shoulder niya. Ganun po. Para, in case po kuhanin po natin yung nasa ilalim na blanket, hindi po siya matatanggal. At we do the privacy as well to the patient. Okay? Ganyan po. I-roll po natin. I-roll. Ang pagtanggal po ng blanket na nasa ilalim po ay pahila po pababa. Pahila po pababa para po yung blanket niya hindi po maalis. Ito po. Ganyan. Ganyan. After po makuha yung maduming blanket niya, ilagay po natin sa hamper. Okay? Sa gilid. Yan po. So, ngayon po, isusunod po natin palitan yung pillowcase niya po. After po natin matanggal, ma-roll po kanina itong one side ng cover ng bed niya, is kailangan po natin magpalit ng gloves. 3 times po magpapalit po ng gloves. Assuming po nagpalit po ako ng gloves. At properly pong hand hygiene. Okay po? So, na po dahan-dahan po natin iangat yung kanyang ulo para po hindi po siya masaktan. So, mag-ask natin siya ng permission dun sa patient na kukunin po natin yung pillow para po palitan po ng cover. Okay po? So, palitan na po natin siya ng cover para po yung kanyang pillow ay malinis. So, now, ito, linalagay ko na po siya yung cover. Tapos, ibabalik po natin sa kay pasyente. Iangat natin ulit yung kanyang head. Ask po natin siya ng permission. Oscar, I lift up your head and put your pillow. 1, 2, 3. Siguraduhin po natin comfortable po yung pillow sa pasyente. So, ngayon po, natapos po yung cover po ng pasyente, kailangan po natin i-check yung mga gilid-gilid ng cover kung nakatuck-in na po sila. So, yung cover po ng bedsheet, kailangan po natin ng i-angle po yung kanyang posisyon para po maganda yung pagtuck-in po natin dito sa may pasyente. Iganyan po siya. Both side po. Lahat po siya. Tapos dito sa part ng kanyang paa, Huwag po natin masyadong itak-in para kailangan po natin siyang ilus para yung paa niya makagalaw-galaw po siya ng maayos. Alright? Ganyan po. Itak-in po natin. Ayusin po natin lahat yung pagtak-in ng kanyang cover sheet. Okay? Tapos po yung kanyang draw sheet. Assuming po na naglagay po ako ng draw sheet. Always po na may draw sheet po ang ating pasyente. So ngayon po, after po natin maayos ang pasyente, tignan po natin siya kung comfortable ang lagay ng ating pasyente. After po natin gawin lahat, i-record po natin kung ano pong na-observe po natin sa ating pasyente habang
Good morning, Mr. Smith. My name is Filma, and I'm gonna taking care of you today. May I see your armband? May I know your name and your date of birth? Okay. Today, I'm gonna wanna change your bed sheet. Is that okay with you? Okay, I'm gonna close your curtain, and I will wash my hand, and I'll be right back.
Place a blanket over the patient and ask them to hold it in place. Slide the top bedding out from beneath the blanket and put it in the dirty linen. Position the patient to one side of the bed and begin removing the bottom fitted sheet and roll it up beneath the patient. Take a clean fitted sheet and place it on the corners where you just removed the soiled sheet. Roll the sheet up and tuck it beneath the soiled sheet. Place the draw sheet lengthwise along the middle of the bed and tuck the remainder under the patient's torso and buttocks. The pad should be hand-folded or rolled under the bottom sheet. Keep the linen beneath the patient as flat as possible. Assist patient gently, rolling the patient in moving to the other side of the bed on top of the clean sheet you just put down. Now, with the other side of the bed free, You can finish removing the soiled sheet and extend the rest of the clean sheet across the bed and secure and flatten the sheet. Put the soiled laundry in the dirty linen. Assist the patient to position in the center of the bed. Place a new sheet on top of the privacy blanket and then pull down the blanket out from beneath the sheet and place it in the dirty linen. Secure the top sheet under the foot of the mattress so that it is flat on both sides. Loosen the sheet slightly so the patient's feet have some room to move. Ask the patient if they can let you remove the pillow from beneath their head. Remove the pillowcase without touching your uniform. Place the used pillowcase into the dirty linen. Put a new pillowcase on the pillow with the tag side going into the pillowcase. Place the pillow under the patient's head with the opening facing away from the door. Perform your standard completion task. Remove your gloves and hand hygiene.
Hi everyone, good afternoon. My name is Juby Ifel, one training of Nurse Caregiver Management Alliance. So today I demonstration how to proper proceeds occupied bed making. Occupied bed making is a type of hospital be a client on it. The purpose this is to keep client clean and comfortable, to promote health and well-being, to conserve the client's energy and maintain current health status. Ayan po. Equipments: bottom sheet, top sheet, rubber drew sheet, cotton drew sheet, and pillowcase, of course, hamper puzzle linen. Ayan po. Purpose: rubber drew sheet is used if the fishing hands undergo force operation while the cotton draw sheet is used to cover draw sheet pretending to create a hot temperature. Ayan po. So now let's proceed. Check the clients and check the needed linens. Ayan po. And then that, wash your hands before gathering the equipments or use alcohol or hand washing or use gloves for the infection control. Ayan po. But, if the patient is conscious, explain the procedure but the patient is unconscious. Ask permission to the patient or relatives. Ayan po. Then, provide privacy. Close the curtain and then close the door. And then, let's assume. Then, wag po nating magkalimutan, introduce yourself. Okay? So, now, let's go na start to bed making. So, now, we're gonna start to bed making. Provide privacy. Close the curtain. Okay? And, close the door. Or, wash your hands and or put some alcohol. Then, if you want to use gloves, can use gloves. Much better you can use the gloves because we are going to bed sitting. Okay? So now we are going to verify the patient's ID and introduce yourself. Okay? Good morning, sir. Hi. Hello. How are you, sir? Okay, my name is Juby Eiffel. I am your assistant for today. So, I'm sorry for disturbing you, sir. I am going to change your bed sheet. So, it's okay for you, sir? Okay. So, now we're gonna start first is, unahin natin yung paghatak dito, guys, sa bawat kanto ng bed ng ating pasyente para hindi po tayo mahirapan sa pag-rolling mamaya. Okay? And then the second, place the top sheet. And, i-rolling po natin siya. Yung isa po niyang paa, ilagay po natin sa kanyang kabilang paa. And then, yung kamay niya is ilagay natin sa kanyang head. And then, ito naman is ilagay natin sa kanyang dibdib. And then, takilid po natin ang ating pasyente. Okay? And, i-cover po natin ulit ang kanyang top sheet. Ayan. So, next, isa-isahin po natin i-roll ang kanyang cotton draw sheet. Okay? And then, put it under patient. The second is rubber draw sheet and put in the under patient. The last is button sheet. Ayan, i-roll po natin siya. And then, ilagay po natin sa ilalim ng ating pasyente. Okay. And then, guys, bago natin papalitan ang kanyang bed, atin munang pupunasan ng towel na, ayan, wet towel. Okay? Ayan. Ayan. Okay? And then, drop dry towel. So, para hindi po basa ang ating bed. I-dry po natin. Okay. So, now we're gonna put the bottom sheet. Ayan. Okay. And then, roll. Roll. And put the under patient. Okay, and then flat the bottom sheet. Yan. And then, tuck here. Tuck. Okay. So, kailangan guys, ipaipit nyo talaga yun dito para pag bagalaw-galaw yung pasyente, hindi po mahatak ng pasyente. Okay? So, next is rubber draw sheet and cotton draw sheet. Okay? So, roll. Ayan, ilagay po natin sa ilalim ng ating pasyente. Ayan. Okay. And then, paipit po natin dito. So, now guys, place the top sheet. So, yung pasyente natin, ibalik natin siya sa dati niyang old position. Yan. Okay. And then, takilid natin siya paharap sa atin. Ayan. Itaas yung kamay. Yung isa naman ilagay sa dibdib. And then, ilagay din ito sa paa. And then, takilid natin ang ating pasyente. Yan. And then, cover the top sheet. Okay. So now, hatakin natin ang kanyang old bleedings. Old. Yan. So, i-roll natin. I-roll ng i-roll. Okay. And then, kailangan hindi siya madikit sa ating damit. Okay. Then, ilagay sa ramport. Then, hatakin po natin ang kanyang bottom sheet. Ayan. Hatakin natin ng padahan-dahan. And then, the next is cotton draw sheet and rubber draw sheet. Ayan. Then, place the top sheet. So, ibalik na naman natin siya sa kanyang dating old position. Okay? Okay. And, cover the top sheet. So, are you okay, sir? Okay. Now, dandahanin natin ang kanyang ulo sa pagkuha sa fellow case. Okay, dadandahanin natin iangat. Okay, alalayan po natin. Okay, are you ready, sir? Okay. Okay. Now we're gonna change the old fellow case. Okay, then through the ramport. Put the ramport. Fellow case, guys, i-half natin siya para madali lang po ilagay yung unan. Okay, and then put the fellow. Ayan. Okay. 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 Ayan. So, kailangan ito. Ayan. Pasok. And then, flat the fellows. And then, put it back the patient. Excuse me, sir. Okay. Alright. Okay, so now, palitan natin ang kanyang top sheet. Excuse me, sir. Okay. And, through the foot the ramport. And then, lagay natin sa baba, sa bed, baba sa kanyang paa ang top sheet. and then cover. So yan guys, ang proseso po ng bead making. Thank you guys.
Good day, everyone. My name is Mylene Calixto, one of the trainees under Nurse Caregiver Management Alliance. Today, I would like to demonstrate the proper way of occupied bed making. The definition of occupied bed making is a type of hospital bed with the client on it. The purpose is to keep the client clean and comfortable, to promote the health and well-being, to conserve the client energy and maintain the current health status. The equipments are button sheets, top sheets, rubber drew sheets, pillowcase. Now, let's proceed. Check the client activity and check the needed linens, whether the client's conscious or unconscious. Then, check the linens needed. Wash your hands before gathering the equipments or use alcohol-based hand washing or gloves for infection control. If the patient is conscious, explain the procedure. But if the patient is unconscious, ask permission to the patient's relatives to be in their cooperation. Provide privacy by closing curtain and doors. And now I introduce myself to patient. Hello, ma'am. My name is Mylene. Today, I'm here to do your bed and change your new linens. Is it okay for you? What's your name, ma'am? Your birthday? How old are you? Are you feeling uncomfortable or any dizziness? Oh, okay. That's good. Before I start, I use glove to gather all equipments. And now, I gonna remove the top beddings and any other things attached the bed. Loosen the top linens. Cover patient with a bath blanket. Remove the top linens under bath blanket. Change the bottom sheets and waterproof pads. How I do this? First, remove the patient and move the body near to me. Then, do cross the legs of the patients and hands. Should be positioned before you turn it. Now I gonna turn my patient into the right side and cover the blanket for her privacy. Adjust the pillow. And the next things is to loosen the bottom sheets and roll it into the center of the bed. Now, put the bottom linens in the bed and put the underpad. Make sure it will touch the low back of patient. And now, I gonna reposition the patient to the center of the bed and put again crossing legs over. And now I turn it again the patient to the left side and fold the bottom sheets under pads. Then reposition the patient on bed and also change the pillowcase after make sure.
Can I come in? Good morning. My name is May. I'm your caregiver today. Can I have your name, sir? Sorry, what's your name? Uh, how's your feeling today, sir? Are you okay? So today, I will show you how to occupied bed making. Okay, sir? Can I start? So now I check the privacy. I-close ko yung curtain. So, i-close yung curtain. And then next, sanitizer. Wearing the gloves. So, cover na ako ng gloves. So, I will show you how to occupy the bed making. So, now, pwede na ako mag-start. So, first, kailangan nating iside yung patient like this. Then, you need to fold. Kailangan nating itiklop yung on the top na blanket. So, I need to change. Yan. Yan. So, ito na yung pangalawa niyang blanket. Yan. This is the middle o yung pangalawang blanket niya na ipapalit ko. So, then next, itagilid ko naman sa kabilang side yung pasyente. Okay. Slowly or dahan-dahan nating itagilid yung pasyente. Ayan.